Okay. Hi, everyone. Thank you very much for joining us here today. And sorry for the brief delay. Just to do quick introductions, my name's Jack Martin, and I'm a senior researcher at the Early Intervention Foundation, and I'm joined here today by my colleague, Hannah.
Hi everyone, nice to see you today.
And we're here to share with you some of the work that we've been doing to support the sector at the moment. Hannah, would you mind moving to the next slide? So, as we all know, the COVID-19 crisis, along with social isolation and lockdown, is likely to have a big impact on children and families. So, at this critical time, EIF have published and are currently developing a range of products to support decision makers and those who design or deliver services. The first of these is a rapid review published a few weeks ago, summarizing what we do and don't know about the remote delivery of services. So, first off, I'm going to briefly share some of the findings of that work, and then Hannah will share some of our other work around COVID, which is currently ongoing, including a second report to be published towards the end of May, based on a series of interviews with individuals within local authority areas to share understanding of how COVID has impacted early intervention. And then we'll respond to some of the questions you've submitted to us. And before we get into it, I should say, while I hope that this will be useful and interesting, at the very least, I hope the webinar is itself a good example of virtual and digital delivery. It's the first time we've done a remote webinar with all of us in different locations, so please do bear with us if there are any technical issues, and we might briefly pause the audio and cameras to address anything like that if it comes up. If you experience any technical difficulties, Miriam from EIF will be monitoring the Zoom chat room to respond to any issues that might arise. And also be aware that we'll be uploading a recording of this webinar to our website over the next few days. Next slide, please, Hannah. And the next one, please. So, given the constraints imposed by the current context, as well as what we were hearing from colleagues who design and deliver services, we expected that virtual and digital services, so those that can be delivered remotely, would take on a new importance as we all adapt to the current situation. So here at EIF, we decided that to play our part, we needed to get a grip on the evidence in this space and to share this with those who need it, including government, local commissioners, program developers, and those who deliver services. So the first product EIF has published to support the sector at this time is a rapid review of the evidence on virtual and digital delivery, which is now available on our website. Next slide, please, Hannah. So we had 5 main questions we wanted to answer as part of this work, and we've set about answering them using 4 main methods, which together amount to a rapid review. So attempting to find out as much useful information as we can, as quickly as we can. And the first set of questions, described on the left-hand side of the slide, are what sorts of virtual and digital services have been developed, and what sorts of things have evidence of working and improving outcomes for children. And we've attempted to answer those questions in 2 ways. The first is by searching clearinghouses, which are essentially websites and online resources that describe specific programs within a given area of focus, describe their evidence, and often explicitly rate programs on the extent to which they have support from the evidence. The second method that we use to answer these what works type questions is conducting a review of reviews. So searching databases of academic literature for systematic reviews that attempt to draw overall conclusions about the effectiveness of certain types of intervention rather than necessarily specific individual interventions. And our second set of questions, described on the right-hand side of the slide, were around the advantages and disadvantages of virtual and digital delivery and challenges around rapidly adapting to delivering services in this way. And we've explored these questions by sending a short survey to program developers and drawing on broader literature and informal conversations with program developers and practitioners. Next slide, please, Hannah. So turning now to the headline findings around those what works type questions. From our review of the clearinghouses, which is described on the left-hand side of the slide, we identified 116 interventions that are delivered digitally. We know there are more out there, but reviewing the clearinghouses at least gives us a helpful look at the sorts of things that are available and examples of what is well evidenced. The most common sort of intervention was interactive personalized interventions that involved no practitioner contact, that includes providing, on the one hand, reading materials and videos, but also interactive elements like quizzes, activities, and tasks provided via apps, games, and on the computer, and also including elements of tailoring according to the characteristics of the participant. The next most common category were non-interactive, self-directed interventions that simply involve providing reading materials and explanatory videos for individuals to work through independently. And then finally, a smaller number involved direct contact with a practitioner. So real-time communication with a practitioner delivered remotely to individuals or to groups, either by phone or by video conference. In terms of the evidence, almost a quarter of the interventions had robust evidence suggesting that they improved child outcomes. And by robust evidence, we mean high-quality trials that demonstrate that an intervention was responsible for improved outcomes. The majority of programs did not have robust evidence of improving outcomes for children. So there is a menu of evidence-based services out there to choose from or to learn from, and some of these are described in our report. Though it is worth noting that these clearinghouses won't describe everything that's out there and everything that has evidence. So choices about what to deliver should always be informed by professional judgment about what makes sense for a specific context and a broader awareness of the other services that are out there. Moving on to our second research activity, our review of reviews, which is described on the right-hand side of the slide. This found that while there isn't much evidence that virtual and digital interventions are more effective than their face-to-face counterparts, there is evidence that they can be just as effective. So when digital delivery is compared to face-to-face delivery in the reviews, the typical range of effects that we see is that virtual and digital services are either less effective or equally as effective. So there is evidence that virtual and digital delivery can work and can support continuity in the current context. Several reviews across a range of intervention types targeting different outcomes found that personalizing or customizing interventions, so tailoring them to the characteristics of specific individuals and building in interactive elements like activities, quizzes, and games, is more effective than simply providing static, non-tailored, self-directed resources to young people. And perhaps unsurprisingly, many reviews also found that including active real-time support from a practitioner produces stronger effects than digital interventions that include no remote practitioner interaction. So in the report, we break these more general findings down and provide more specific guidance by type of program in terms of what outcomes they intend to achieve. We won't have enough time here to get under the bonnet of all of that, but as two example areas to add some color to the general level findings, I'll quickly describe what our review found in terms of services designed to support mental health and well-being, and in terms of services designed to reduce crime, violence, and improve child behavior. Next slide, please, Hannah. So starting with interventions aiming to improve mental health, described on the left-hand side of the slide, our review identified a real range of provision here, targeting outcomes such as depressive symptoms, anxiety, stress, and self-esteem. In terms of how these services were delivered, many were internet-based and involved working through a set of self-directed online modules consisting of videos, audio, picture, and interactive components such as activities and quizzes. Many of these focused on approaches such as behavioral activation, cognitive behavioral therapy, interpersonal psychotherapy, and mindfulness. Also, many identified interventions also involved active therapist support, including in the form of motivational interviewing or solution-focused brief therapy delivered via phone, video conferencing, or online chat room sessions. And the reviews identified that although virtual digital interventions might not outperform traditional face-to-face interventions in terms of supporting mental health, they may be equally or similarly effective. So several reviews noted that the virtual and digital interventions they identified, on average, demonstrated improvements comparable in size to the effects identified in reviews of face-to-face interventions. As mentioned previously, it was identified that personalization and practitioner support can really increase effectiveness. So in terms of personalization, several reviews suggest that the use of static educational materials or unguided self-help content was less successful. and that instead interventions should be interactive and involve elements of personalization to hold the attention of young people. So qualitative analyses explored in one of the reviews of mobile apps suggested that users liked interventions with a game-like feel and relatable interactive content. Educational materials, on the other hand, were perceived as boring. In terms of practitioner support, reviews were generally quite consistent in suggesting that having active therapist support, so communication with actual individuals who provide some or all of the treatment, produces larger effects than predominantly self-help type interventions. The clearinghouses describe a number of specific individual interventions in this space. We know that this list isn't exhaustive, but by way of example, one robustly evidenced intervention listed there is called Overcome Social Anxiety. That's a program that aims to reduce social anxiety in young people aged 18 or over with existing anxiety issues. It's delivered online, and young people work through a series of personalized cognitive behavioral therapy modules. Personalization is achieved by issuing a questionnaire at the beginning of the modules, and then modules being personalized on the basis of what the young person reports about themselves. And a randomized control trial found that after completion of the program, participants had significantly reduced social anxiety. Moving on to interventions designed to reduce crime and improve child behavior, described on the right-hand side of the slide. Again, our review identified a wide range of intervention types, including self-directed interventions for parents to improve child behavior and anti-bullying programs. The services for parents include interventions that present information parents need to manage behavioral problems via non-interactive means like podcasts and DVDs, but also by interactive means, making use of online software. And they also include interventions with varying levels of practitioner support via phone or email. As with mental health and well-being, the reviews identified some evidence that virtual and digital interventions may be equally or similarly effective to their face-to-face counterparts, with some reviews indicating that the outcomes of online programs were consistent with effects reported in reviews of traditional forms of parenting training. Again, there was some evidence that personalization and practitioner support can increase effectiveness. Several reviews identified that self-directed treatment supplemented with added therapist or practitioner input can yield greater reductions in child behavior problems than self-directed treatment alone. And again, the clearinghouses describe a number of specific individual interventions in this space. The list isn't exhaustive, but an example of one robustly evidenced intervention is Triple P Online. And this program aims to improve children's self-regulation skills and self-confidence and to reduce behavioral problems. It's delivered to parents with children up to 12 years old, and it's delivered via a website that contains 8 modules focusing on positive parenting principles and includes personalized content, interactive exercises, and video-based modeling of parenting skills. And 2 randomized control trials found that after completion of the program, children of participants had significantly improved behavior. Next slide, please, Hannah. So turning very briefly to our second set of questions around benefits and challenges of digital delivery, our review identifies a whole range of things to be aware of in this space, and more than I can cover in the time that we have available. So I do encourage you to take a look at the report. But to quickly describe one example, we know that for certain types of interventions, building a trusted relationship or therapeutic alliance between practitioner and participant is absolutely crucial. But one risk and anxiety around remote delivery is how do you build that relationship when you aren't face-to-face with someone? Clearly, not being in the same room as someone introduces challenges. However, our review did find that while the extent of research on the therapeutic alliance in the remote delivery context is still quite limited, there is promising evidence that it's possible to successfully build these relationships remotely. And our review also identified some practical tips for doing that. So the first bit of practical guidance is around delivering the first session in person. Clearly, this is difficult to do right now. However, individuals who feel less comfortable opening up to a practitioner through video conference may benefit from an initial in-person meeting to establish rapport. The second bit of practical guidance is around increasing contact time. So more time with practitioners is associated with improved relationships. So increasing contact time over phone or video conference may offset some of the disadvantages of remote delivery. The third bit of practical guidance is around practitioners adapting their behaviors and communication style to better suit digital delivery. And useful adaptations include, firstly, practitioners providing more deliberate and overt non-verbal responses, for example, by purposefully exaggerating tone of voice, gestures and mannerisms during video or telephone calls. Secondly, practitioners should actively pay more attention to social cues and signs of emotionality to offset the disadvantages of not being in the same room. For example, by paying close attention to facial expressions, tone of voice, or body language. And then thirdly, it may be useful for practitioners to ask more questions than they normally would to avoid misunderstandings and ensure that they've interpreted the participants' experience correctly. Next slide, please, Hannah. So very quickly, the key recommendations arising from this work are, firstly, virtual and digital delivery can work and can support continuity right now. Secondly, adapt carefully. We shouldn't assume that a service that's normally delivered face-to-face will work equally as well when delivered digitally. It's important to identify what the key components of your intervention are, what we think makes it effective, and make sure they're maintained in the new adapted digital service. Thirdly, prioritize personalization, interactivity, and where possible, professional support. And then lastly, pay attention to engagement. So it may be more difficult to keep participants engaged in digital services compared to face-to-face services. So it's all the more important to develop a strong engagement strategy and monitoring systems to make sure that interventions are reaching their intended recipients. And on that note, I will hand over to Hannah to tell us about some different work.
So I'm going to talk to you about another couple of pieces of work that we've been doing as part of our response at the Early Intervention Foundation as a result of COVID. The first piece of work is a qualitative piece of research that we've been doing jointly with Action for Children, where we've interviewed 31 in total kind of heads of service, service leads, senior commissioners and head teachers from local areas to understand a little bit more about what the impact of COVID has been on the children's sector and help us develop a real-time picture of what that looks like in terms of early years provision, early help and other family support. We asked people what their critical questions were at this time, and the idea is that we are hoping to use this information to support decision makers as lockdown is eased and going forward through our work programme. So I'll just tell you a little bit about some of the early findings, which will be in the report, as Jack mentioned, available towards the end of May. The first thing really to say is that the children's sector has been incredibly responsive during this time, and that was not an interview went past without that being really highlighted. People have responded incredibly quickly to this crisis, and there were many very heartening examples of partnership working that have been developed during this time, new groups coming together, increased data sharing, and really partnership working focused on identifying those most at need. The other thing that was highlighted was the resilience of the workforce. Service leads really highlighted this as a particular strength, staffing being flexible, staff responding to changes to provision and embracing and the new digital world in which we're living. The other kind of key opportunity that was highlighted was just the accelerated rate of change. So there were quite a few examples of local authorities really flipping services on their heads and changing at unbelievable speeds to meet the needs of children in local areas. Of course, there have been significant challenges, and a key concern has been the identification of new cases. So many local areas talk to us about kind of reduction in flow of referrals and a few reasons why they thought this might be. Perhaps in terms of referral pathways such as schools or other universal services that may not have been operating quite as they were before COVID, and the identification of cases which might have been picked up face-to-face previously. So, for example, specific concerns around subtle ways that domestic abuse, for example, might have been picked up, and a concern that changes to the digital delivery may have made that more difficult. But in general, there was confidence amongst most that they were responding to those with greatest risk. But across the interviews, there were concern about specific groups that they thought might be falling through current provision. Just a few examples of those. So isolated new mothers, those experiencing domestic abuse, SEN, and several other groups were highlighted as potentially missing out on some services or falling through identification processes. So that was a concern for many. And then finally, as kind of lockdown eases, the key concerns were around transitions, both in terms of transition to different delivery models, what will stay and what will go in terms of how delivery has changed, but also transition for children between nursery and between schools as a kind of key consideration. This was linked to a concern in demand going forward. So for those who may not have been identified during this period, there was a concern that this might lead to increased demand after lockdown was eased and individuals or children are more easily identified. So these were some of the things on people's minds. I mean, I think there's a couple of responses here at EIF that we're keen to look at, and I'll tell you about a project that we hope addresses a little bit of some of these concerns. So we're keen to support in any way we can, and we have an open call out at the moment to local areas who are experimenting with digital delivery, offering short-term practical support in evaluating these new methods of delivery. We're aware that so much has changed and that in many cases tweaks or even redesigns to evaluation approaches during this time may be needed to understand how people are using digital delivery, whether it's working, and what the impact of it is in specific areas. And so we're offering some kind of short-term hands-on support, which might be theory of change development, data review, looking at measurement tools, for example, to support local areas to make the most of this time to test the effectiveness of their digital delivery modes. So if that's something that is of interest to you, my email is just here, hannah.wilson@eif.org.uk, and you can contact me and we can discuss that further. Now I'll just pass back over to Jack, and we're going to answer a couple of questions that came through about this work.
Thanks very much, Hannah. So I think it's time to turn to some of the questions that you've submitted, and we'll try to focus on the ones that we think are covered least by the presentations. So to start, several of the questions we received fundamentally ask, what are the biggest risks around digital and virtual delivery? There's a lot of detail on this in our report, but I'll briefly discuss 4 major risks we identify that I think most closely match the questions we've received. So one clear disadvantage is internet access, reduced access and barriers to participation. Most households are likely to have internet access in some form, that disadvantaged households may have fewer internet-enabled devices and may have restrictive data limits. And clearly this is a real challenge. I would say if there's no way to equip a household with internet access, then there are still options, though clearly a reduced set of options. So it's worth noting that many of the interventions we've picked up rely on telephone communication with a practitioner, so don't necessarily require internet access. And some programs involve or supplement telephone contact with mailing participants DVDs and workbooks, which again can be worked through independently without internet access. A second key risk we identified is around maintaining effectiveness when translating face-to-face services to virtual and digital delivery. So respondents to our survey raised the challenges of rapidly moving to virtual and digital delivery while ensuring that the program remains as effective as the original face-to-face version. And as I said previously, it's very important that we don't simply assume that a service that's normally delivered face-to-face will work just as well when delivered digitally. Adaptation needs to be conducted very carefully. So it's important to identify what the key components of your intervention are, make sure that they're maintained in the new adapted service, and consider how they might be impacted and respond to being translated into a digital service. So drawing on the views of practitioners and revisiting the services theory of change would be useful exercises here. And as I mentioned previously, one concern around adaptation to remote delivery is the ability to develop a meaningful, trusted relationship. So being mindful of the practical guidance described earlier will be important. A third risk we identified is around engagement. So online services that require participants to engage with self-help material in particular may be challenging for some, and it came through the evidence review that there are potential issues with retaining individuals in treatment and making sure these programs are fully utilized. So in terms of mitigating against this, there are some options here. One is designing interventions to be as engaging as possible, and where appropriate, involving interactivity, personalization, and practitioner support. If it's the sort of intervention that relies on building a trusted relationship, then again, important to follow the tips on best practice around establishing that remotely. It's also important to develop monitoring systems to let you know when the intervention isn't reaching who it should, and making use of reminders, perhaps text reminders, to encourage participation. And then finally, we can test and adapt, drawing on practitioner and participant views of what is working well, what is engaging, and what isn't. A fourth key risk is around the preferences of individuals. So some people will have a strong preference for traditional face-to-face interaction and will feel anxious or unconvinced by having to use an unfamiliar digital service. And our discussions with practitioners revealed that in some cases, participants have been reluctant to access remote services, feeling that they might be inferior to face-to-face appointments. So some tentative solutions here would be to circulate instructions on how to use the digital platform in advance to reduce anxieties around getting things to work. It could also be worth drawing on the evidence in some way to highlight the successes of virtual and digital delivery to reassure individuals about its value. So those are some of the key risks we identified, but I would encourage you all to take a look at the report, which has more detail than we have time for here. Another set of questions we received was what research has been undertaken about how services have been impacted by COVID-19. So as part of the review work that I mentioned earlier, we conducted a survey of program providers to try and gauge the impact on delivery. The survey was completed by a range of providers, so that will include parenting programs, mental health interventions for adolescents, and all sorts of provision. And our survey found that most intervention developers are adapting delivery in response to COVID-19. So the vast majority of respondents to our survey are continuing to deliver services rather than halting altogether, but the vast majority of them are doing so with major adaptations to the way in which they deliver services. So focusing for a second on the services that are stopping delivery altogether, they are typically services with no existing virtual and digital components. And some of those providers commented on some of the difficulties of adaptation, including one respondent who noted that the lack of available funding for developing digital adaptations. And several respondents also commented that programs had been stopped to allow practitioners and resources to be diverted to services supporting local authorities or those serving a population with greater needs. In terms of the services that are continuing delivery, which seems to be most of the services that responded to our survey, they're typically adopting a variety of virtual and digital approaches, which ranges from the ad hoc use of phone calls, WhatsApp, and video, to actually redesigning content around digital methods of delivery and tailoring it to the challenges posed specifically by COVID-19 for children and families. Something else that came out of our survey is, whilst the impact of COVID-19 has been felt by all sorts of services and interventions, it seems to have hit universal services the hardest. And that might suggest that interventions targeting those with greater levels of need are continuing, perhaps because a pause in those services is likely to have more severe consequences. We also found that although continuing with services, several providers have paused the delivery of some components that haven't yet been adapted for remote delivery. And that might suggest that some programs aren't yet running at full tilt, which may reduce effectiveness. We also noted that some program developers expressed an interest in retaining some of the virtual and digital components that they've recently devised in response to the current context. And that suggests that the impact of COVID on service design might actually outlive the current situation. So ultimately, the impact seems to be that while some services have halted delivery, most are rapidly adapting by making use of virtual and digital delivery. And there's also some signs that these changes might persist to some extent. And now I'll hand over to Hannah to address some of our other questions.
Thanks very much, Jack. So I'm going to address two questions, and it's kind of worth saying that these come from the perspective of the qualitative interviews that we've done with local areas. So the first question is there anything that services can do to contribute to EIF's ongoing research and evaluation of virtual and digital delivery? So it's worth saying here that Jack has done this wonderful piece of work looking at digital delivery that we've just talked about. In terms of our ongoing research and evaluation, what we have at the moment is this open call for those wanting support. So we're keen that we help wherever we can to take the opportunity to learn about what works where possible from this situation, whether it's understanding, who's using your services, running comparisons between your digital interventions and previous non-digital provision. We're happy to support you in any way that we can to take this opportunity to contribute to the general understanding of what works in terms of digital delivery. If you're a guidebook provider and you have learning to share or have made changes to digital delivery, please also do let us know about that if you think it's of interest, so that we can continue to build our evidence base. The second question that I'm going to look at is, how do we guarantee a situation has improved without ours or other professionals seeing it for ourselves and relying on a call? So I think this picks up on some kind of safeguarding concerns that I mentioned earlier that were key in people's minds at this time. I mean, it was a challenge highlighted by many interviewees that identification of safeguarding issues is more challenging in a digital context, and some of those subtle signs that previously might have been identified either by going to people's houses or seeing them on their own and speaking to them perhaps without other family members or children present, may have picked up on issues. So a couple of ways that interviewees suggested that they were trying to minimize this was, where possible, doing video calls over telephone calls, increasing the likelihood that you can see if someone else is in the room when you're having a conversation, either with a young person or parent, and taking additional time to check that individuals were on their own in specific contexts, to understand kind of how freely or not they're able to speak. More broadly, understanding kind of the quality of provision and whether it is improving as a result of your service. links us back, I think, to the work around evaluation. You know, there are a variety of kind of digital data collection methods that can be used to help you understand the impact of your work during this time. And if you're interested in hearing about more broadly how to think about this, then please do take us up on our evaluation support offer. I'll now hand back over to Jack just to close.
Thanks very much, Hannah. And on that note, I'd like to close the session and thank you all very much for joining us this afternoon. Just as a reminder, the report that I spoke about is on our website right now, and the report that Hannah spoke about will be on our website towards the end of May. Please do get in touch with Hannah around the evaluation offer if that's of interest. If there's anything you would like to follow up on, please email info@eif.org.uk. And also, please be aware that we should be uploading a recording of this webinar to our website over the next few days. So I hope that this has been interesting and useful for you. And thanks very much again for logging in. Bye.